Hello, this is the second video on diabetes. In this one, I want to talk about a kind of an interesting association between meat consumption and risk of diabetes. There are several papers that go into this. This is one that's basically a meta-analysis. So they look at several other papers and other studies and kind of aggregate the data and see what the weight of the evidence is. In this paper, they looked at 28 articles where they compared people by meat intake. And when they looked at the risk of developing type 2 diabetes with meat consumption, there was a 33% increase in people in higher risk of diabetes in people that had more total meat consumption, 22% for red meat and 25% for processed meat. No difference for poultry or fish. And it was a dose response. That means the more meat you ate, the higher the risk was. So, so that makes it seem when you have a dose response to something, it makes it more likely that there's causality and not just correlation for this. So that's very interesting that there is a dose response for red meat in the risk of developing type 2 diabetes. There was no association with poultry or fish, and there was a correlation with processed meat, but it was not a linear dose response. But it was still the more processed meat you ate, the worse your risk of getting type 2 diabetes is. Also, interestingly, there's another paper out of Harvard that talks about the cooking method. And if people, regardless of how much meat you ate, if more of your meat consumption was using open flame or high temperature cooking, such as grilling, barbecuing, broiling, roasting, and frying is included. Frying is like grilling. And most people like to have meat by one of those cooking methods because meat just tastes better when it has a little sear on it. Um, and so if you have that, they looked at this a large cohort looking at over 130,000 people, and they looked at people before they had diabetes, and they followed people for several years, like 10 years or more, and saw diabetes as it developed. And they controlled for weight and total consumption of meat, chicken, and fish, but they compared the higher frequency of open flame or high temperature cooking, and they found out that there's a 28% higher chance of you getting diabetes if you were cooking food by high temperature cooking, which is what most people do. People aren't out there boiling meat generally. Some people sous vide meat, but mostly it's grilling, barbecuing, broiling, roasting, or frying. That's how most people consume meat, and so that's an interesting association as well. On the flip side, there is this study, which was also a meta-analysis of, but this is a meta-analysis of randomized controlled trials. And usually, um, interventional prospective randomized trials are a higher level of evidence than observational studies. So in this study, this is they looked at 28 observational studies where it means they just looked at people and figured out what they were eating and watched them over time and see if they developed type 2 diabetes. The cooking method study was also the same. In this one, what they're doing is they randomize people to eat meat or not eat meat for a period, and then they test them for something. So you're intervening in people, not just observing. And these are higher quality studies. And in this study, what they did is they had people, they looked at all the studies where they had people eat meat or not eat meat, and then they tested them for insulin resistance and fasting glucose, which are two of the factors that are deranged in type 2 diabetes. Those type people with type 2 diabetes have higher fasting insulin, and they have insulin resistance, or they're less sensitive to insulin. They don't respond to insulin as well. And in these studies, they showed that there was not an impact on meat intake and those factors, which is a kind of an interesting finding. And I'll talk about why that maybe that doesn't mean that meat does not uh, cause increased risk of type 2 diabetes. If they had a mechanism by which it does that, which these randomized control studies would have found out, that would bolster the argument that meat causes type 2 diabetes. The observational studies are quite strong, and there's a strong association between two, but these randomized control studies don't seem to find an association. Here's the issue with that. It's not like eating meat will immediately turn you diabetic. It's something that occurs over many years. You know, you're probably eating meat for decades before it probably causes a problem. In those cases, if that is the mechanism that you need a long amount of exposure to something before it causes a problem, a randomized controlled trial will not necessarily be able to parse that out, because you're not going to run randomized control studies for 20 years or 15 years. You're going to run them for a month or a week. And that may not be enough time to show any kind of mechanistic change. So that's kind of the flip side of this. So in these studies, they are good studies, and in general, these interventional studies are higher quality evidence than these observational studies. But if the intervention requires a long period of time to show any effect, these randomized control trials are not going to find that effect, because they're not lasting long enough. You can't. It's too impractical and too expensive to run these trials for that length of time. All right, so very interesting. I think that the weight of evidence currently right now would be to avoid meat, especially red meat and processed meat, for many other reasons, like this searing of this high temperature cooking of meat is known to cause these things called heterocyclic amines and polycyclic aromatic hydrocarbons, and they are a known carcinogen. So it's very well known that those mechanistically um, uh, cause effects in the body that will lead to cancer. So, I mean, it's good to avoid it for that reason. Also, those compounds can lead to hypertension, and even if it doesn't affect type 2 diabetes, it does affect those two things. That's pretty well known. But the observational study is quite strong. Almost every observational study shows a pretty strong link between red meat and processed meat consumption and type 2 diabetes. There is no current mechanism, randomized control study showing a mechanism, but just because we don't know the mechanism doesn't mean that it's the case. And again, these randomized control studies, they just don't run long enough to probably parse out what's happening in diabetes. So probably best to avoid them as much as possible if you're trying to reduce your risk of diabetes, as well as hypertension and cancer. All right. Well, thanks for watching, everyone.